without further ado, we'll go ahead and start cracking on with this. Now, just a general sort of first description as to, well, what we are. So the UK Medical Student Association is a society that's aimed at basically supporting medical students across the nation in a variety of different ways, specifically either through peer-to-peer support, hosting events, and sharing resources. And typically as medical students and junior doctors and that sort of thing, I myself am an F1 doctor working, but even you still have that sort of close-knit link between medical students as well. We are like a big bunch of just, you know, like we're a big club, and we all want to try and make sure that we all succeed as well. So the society aims at trying to support all those medical students across the nation. So as it is, our main goals for the upcoming years to develop a lot of different programs, exam resources and MCQs, more talking about the education side of things, since I'm the education lead. We'll be looking at hosting weekly webinar sessions, making sure that we're there as a support for students who have any budding questions about you know, stuff like exams and how to get around like stuff and life inside and outside of medicine as well. So we do recommend you keep up to date with our socials as well, which we'll link as well at the end, and you know, keep up to date with when we're posting about events and stuff like that. And hopefully it's like, you know, we can begin to develop a sort of, you know, new status that we have as a big support system for medical students across the nation. Those are like our main sort of goals, but that's basically it from me in terms of my intro stuff. So now we'll basically go and dive into each year. So we've got a range of different speakers covering each specific year. First off, starting with Tulika as well, covering first year at QUB. So I will hand over the reins there.
Thank you so much, Bilal. Can you hear me, by the way?
Yeah.
Am I audible? Perfect. Hi, everyone. My name is Tulika Nahar. I'm now a second year medical student at Queen's University of Belfast. So just a really quick presentation taking you down about my experience in first year, some of the resources I've used, and some of the top tips that I wish I knew when I was going into med school. Yeah, let's just see if I can take control. Perfect. Do the slides move okay? Perfect. Okay, so just really quickly, what I'll be covering today, an overview of teaching methods, but just to point out though, med schools, you know, different med schools have very different styles of teaching methods used throughout, and I'll be mostly talking specifically about the way we learn at Queen's. Really quickly about syllabus and what are some of the things that we learn in year one, a sample timetable to accompany this, and some of the crucial study resources and top tips. In terms of the core material, our Queen's utilizes a case-based learning approach. So we have lectures, and on top of that, our learning is facilitated by case-based learning. In traditional lectures, essentially occupies the main crux of our material that we learn. It's accompanied by learning objectives, which essentially is the syllabus of year one. It covers everything that we need to know. And in year one, we're divided into groups, small groups, in which we have our tutorials, our learning occurs in small groups, and also our cases. And it's a group of 10 people. And every 2 weeks, we get a new case, clinically relevant case to everything that we have been learning in lectures, tutorials, etc., just to really kind of put into, just kind of understand everything that we're learning more in a clinical context. And then we have tutorials and practicals on top to really solidify the learning. So practicals can come in form of, you know, physiology practicals and histology practicals, and then tutorials again occur in a small base group. We also have dissections. In your med school, you'll have either dissections or prosections. The major difference being in dissections, you actually get to go in with you'll have a cadaver in your small group, and you'll actually get to mess around, actually look at the structures yourself, whereas in pro-section, a tutor will guide you through it. So just a really quick sort of timetable. I took this from weeks 9 to 10 into year 1 when we were covering BCR, which stands for blood, cardio, and respiratory. I'll talk more about the topics that we learned in just a bit. So if you can see on the right side, this is how our week 9 to 10 look like. So we would have about 6 to 7 lectures a week. We would have 2 days of heavy lectures, and then rest would be accompanied by CBL, tutorials, CSEC, all that stuff. So, so when we were doing our case anemia, we had lectures relevant to blood, oxygen transport in blood, anemia classification, treatment, all that stuff. So everything in that week was relevant to our case, which is quite a nice way to do it because you learn everything, physiology, pharmacology, relevant to a specific part of medicine, and then actually get to see that happening in the case. So it kind of all just paints a really good picture in year 1. And then, so some of the other teaching methods, so in terms of clinical skills, so we have CSEC. I know that in a lot of schools, in year 1, you guys don't have OSCE. So OSCE is an exam that you take at the end of year 1. It's called an objective structured clinical exam. In year 1 in Queens, we are required to take the OSCEs. It actually counts for 50% of our grade, and I'll walk through our assessments in just a bit. And throughout our year, we have CSEC, so designated classes, where we can learn these clinical skills. And in the first 2 years, the emphasis of all the clinical skills is on normal, so we don't actually cover any sort of pathology or abnormality in our clinical skills. So it's just about normal procedures, examinations, history taking. Then we also have clinical experience. In clinical experience, it's again, it's small. You're placed into small groups and you're under the supervision of a GP tutor, which kind of breaks down the entire history taking process, and you get to practice with real patients. And then you also have communication skills to add on to that. That's just small tutorials to practice your communication skills, which will help in your OSCEs. And then on top of all the core work, so your clinical skills and your and the material from lectures, you have supplementary assignments. So you have something called a family attachment report. I'm not too sure if this is very common in the other med schools, but in Queens, we get placed into, again, small groups in which we are assigned a patient, and you interact with this patient on multiple occasions, and by the end, you produce a report, a comprehensive report about how they're leading their lives and the impact their illness has on their lives. So again, it's very year 1, it's very clinically orientated, which is great. You get all that experience just in year 1. And then you have something called an SSE, which all schools have. And this is something that we did in the 2nd semester, and you get to choose your topic. And this is something that you work on alongside, and you'll be assessed in different ways depending on your SSE. And then we also have ePortfolio, which is just a place where you can document your personal and professional lives throughout med school. In years 1 and 2, they're not as important as they are in the clinical years, where you can actually document all the skills that you have learned and etc. So just now going on to syllabus and how we examined. So just the 3 big blocks at the top, those were our 3 big units. So we had an 8-week block covering fundamentals. So this was everything from cell biology, genetics, so very basic stuff, very preclinical stuff. And then we had blood, cardiovascular, and respiratory. So we covered pathology, physiology, everything related to those three systems. And then we had MSK, or musculoskeletal, and we covered upper limb, just upper limb. We're actually going to do MSK in year 2, do the lower limb. And I'm not sure why the synoptic test, whatever I wrote, it's blank. But for synoptic test, this is the way we're assessed. So 50% is a synoptic test and 50% is OSCE. So what a synoptic test essentially was for Queens is you get assessed on everything you have learned in lectures or even in your clinical skills classes. You get assessed in a 180 MCQ question, a 4-hour-long paper at the end of the year. So we actually never had any sort of quizzes or any sort of test material throughout our year. We just had one really big one towards the end, about May-ish time, called the synoptic test. It's worth 50%, and then you have your OSCEs, which are worth 50%. And in your OSCEs, you have, again, just examination of all the clinical skills that you have learned. We also had like a mini progress tests, but in year 1, they don't count. And for those of you that don't know, progress test is quite a new thing that's been implemented in a lot of schools. And essentially the way it works is that there are about 100 or so MCQs covering contents all the way from year 1 to year 5. And it's supposed to emulate the way UKMLA the test is going to be. And for year 1s, we took a few formative progress tests, but they were not counted. And yeah, and then just your family attachment report and SSC, you just have to pass those to pass year 1. And I know that Queens actually don't cover a lot of systems in year 1, and other schools cover loads more, but all our pressure is in year 2 in Queens, which is great. And just lastly, some of the key study resources I've used. I personally mostly just went from the lecture content and did questions. I didn't really consult any of textbooks, but I do stand by the ones I put on the board on the presentation. So Grey's Anatomy for Students has really good MCQs. Zero to Finals is a really good compact book, goes into a lot of detail into pathology and basically a lot of key information that you need to know. But it's not as relevant in year 1. In year 1, because we were only tested in lecture content, I did just go off lecture content. OSCE Revision Guide is a great tool to just kind of know more and understand more about why certain things happened. And then just Geising Hall Medical Physiology book was also a great help. Other online resources, Teach Me Anatomy was very helpful. When I was doing cardiovascular, I found this site, Cardiovascular Physiology Concept, to be very, very good. Like, it really simplified a lot of the concepts. And similarly, they have a cardiovascular pharmacology concept. And then just on YouTube, there's Bio Ninja Nerd, and Medicosis Perfectionalis. They both are just amazing at what they do. And yeah, and again, so for questions, these are some of the resources I used. Again, I didn't do so much in year 1, but if you are looking for question banks, I would say PassMed, Anki. You could always look at the flashcards other people have created, or you could always create your own. QuesMed is good. And honestly, even if you search up medical school questions year 1 related to a specific system, a lot of questions come up online. So just lastly, to finish up, some of the top tips are some things that I wish I knew before coming to med school. So firstly, I learned that passive learning doesn't really do any good. So what does passive learning mean? It just means like you're taking notes from lecture slides or from a textbook, and the way you're revising is just rereading your notes or annotating slides. Although it feels good, it actually doesn't help you learn. The way you learn is through active recall, and that's why it's so important to put in time in your schedule for revision and active recall. So active recall, the way you could do it one way is like questions, but also like getting a blank paper and starting from the top and writing everything you know about a certain topic without consulting any resources. And it's really important to put that in your schedule, even if it's just for a few minutes. Again, questions is really great way. Another thing is to get involved in societies, because in year one, you get the most time in your 5 years or 6 years of med school. So make the best use of it, actually get to know your interests. And, you know, this is the year where you can explore everything and anything. And lastly, you're going to be experimenting a lot, whether it's, you know, with your study techniques, how you learn. You're going to be experimenting a lot, so get comfortable with it. And yeah, so I just wanted to put this in because looking back at year one, you know, these are the two memes I relate to the most. Yeah, and I genuinely do believe it's all downhill from here, because year two is hard. But anyways, that's me. If you guys have any questions, my email is at the start of the presentation. Thank you.
Thank you very much, Tulika. That was very, very informative and helped me reminisce 10 years. I'm joking. I like 5 years back into med school, so that was very, very, very nice to hear as well. And genuinely, it's a lot of the stuff that you carry from first year up until like the end of 5th year as well. Like I'm still using Anki as well, prepping for stuff like MRCS, so it carries on. It's like kind of starts your building blocks. I think the main thing is also just to have fun as well. Like you don't, like from year 1 to year 5, it's still a long time away, so you know, just enjoy it as well during the process. But yeah, no, thank you very much. Thank you. Very nice to hear. It's also a lot of similarities with Manchester as well. Obviously, I went to Manchester, so it's quite nice to hear as well. Moving on, we will shift over to year 2. And if I am correct in, you know what, the floor is yours. Thank you.
Okay, so my name's Aisia. I'm currently a 3rd year medical student at Nottingham University. So, like I said, this will change based on what school you're going to, what uni you're at, what you'll cover in year 2. But I think most unis are kind of still focusing on anatomy and clinical skills in year 2. We had our first OSCE in year 2. We didn't have one in 1st year. And the way that our exams are structured are a bit different to how Tulika said hers were. So hopefully talk a bit about that as well. So like I said, every med school is different. Even though we all kind of end up learning the same things, they do it in completely different ways. So you might do your things in a different order to the way that I did. That's perfectly fine. But hopefully some of the things I talk about will be relevant to you. So for anatomy, I think anatomy is one of them things that's just so big. It's such a giant topic, and it can be, I think a lot of people do find it quite difficult. So in my 2nd year, we covered the abdomen, the back, spinal cord, pelvis, head and face, brain, eye and ear. That's loads of stuff. And I think a lot of anatomy teaching is quite self-directed as well. You usually have to go out in your own time and learn things, because we would only have 2 hours a week in the DR to do our dissection of the cadavers and look at prosections and things. That meant you did have to spend quite a lot of time actually taking in information and learning it in your own time. And that can be quite overwhelming, anatomy can, because there's a lot of it, and there's loads of small minuscule things that you feel like you need to know. So don't worry if you are feeling a bit overwhelmed with it. I mean, we all get through it. Some people really do enjoy anatomy, and overall I did quite enjoy anatomy. I might be a bit biased because I'm currently doing my dissertation about anatomy and the anatomical teaching, but the actual process of learning anatomy I quite enjoyed. But the amount of things you need to know is a bit crazy. I preferred anatomy at a bit more of a gross level, like looking at the overall anatomy rather than the really minute nerves and arteries and that sort of thing. I would really recommend breaking things into chunks and doing it from the start of the year. Start looking at your anatomy. I know it seems crazy, but it'll come to you so much easier before exams, because anatomy is one of them things that are really difficult to cram, because you'll get confused because things have similar names and similar descriptions. So it's much better if you can start your revision for anatomy early. So again, Teach Me Anatomy is a really great resource. It makes everything a lot simpler, because our textbook is, our recommended textbook is Essential Clinical Anatomy. I find the textbooks are a bit too detailed, really. Sometimes they are good. They're really good for diagrams usually, but the actual text in the textbooks can sometimes be a bit too much. So Teach Me Anatomy is a really great way of kind of condensing that down to the key bits you need to know. Complete Anatomy, our university has given us access to Complete Anatomy. I don't know if your other universities have, but if they haven't, it's worth asking them if they could, because what it is it's a program that you can get on your computer, you can get it on your phone or your iPad as well, and it's like a 3D model of the body, and you can see where the organs are in relation to each other. You can click on things to see which muscle is which artery is which, that sort of thing. So it is really useful. So if your university doesn't provide it, I would strongly recommend sending them an email and asking them if you could get access to it. Make sure you pay attention in dissection. It is really interesting, and it's a really great experience to actually be able to carry out dissection. Not everyone does get that experience, so make sure you pay attention and you be respectful as well. And practice with friends, and this goes for basically anything really, but I think anatomy is one of them ones that are really great to practice with your friends. Get your friends to make practice questions for you, get them to mark your labelling of diagrams and that sort of thing, and you can teach your friends things, and it's a great way for them to learn and for you to learn as well. And on to clinical skills. So my university experience with regards to clinical skills and things is a bit different to how it usually would be at Nottingham because of COVID in first year. So we kind of had a lot of clinical skills kind of crammed into second year. Same thing with placements. We didn't really have the opportunity to go on placement in first year, so that was kind of crammed into second year, but usually they're spaced out throughout both years. Different societies at unis will likely provide you with mock OSCE opportunities, so make sure you take them. I'm part of the Clinical Skills Society at my university, and that was only set up this year. There was never a dedicated society for clinical skills before that. So if you think there's a gap and a society could be created, go ahead and do it, because you might be able to get some funding as well to make a good society, not just for yourself, but for future medics as well. OSCEs is another great one to practice with friends, with family. Sometimes it's better practicing with family and non-medic friends, because the only problem with practicing with medics is they will know what you're doing wrong, but they also might change the way that they're acting because they know what you're going to do. So sometimes practicing it with family, make sure that you really explain yourself properly, because they won't know what you're asking them to do. And it's always great to have a checklist to make sure you're doing all the right things, and ask your friends to check you via a checklist as well. It might be worth investing in some equipment. Don't go buying really expensive equipment. I think it's on MediSave. You can get quite a cheap sphygmomanometer for blood pressure results for about £15, maybe a bit less than that, about £12. Make sure that you get your stethoscope discount through I think it's BMA. But make sure you get your stethoscope discount. You should get a stethoscope because you will be using it, especially on placement. And also other things that you can get for fairly cheaply, especially if you're splitting them. Maybe if you have some medic friends, you could split the cost of tendon hammer, ophthalmoscope, or stuff like that. Be confident in your exams, even if you don't feel confident. If you act confident, then they'll think that you know what you're talking about. So just be confident, be relaxed. The actors in your OSCE, they're not going to be mean to you. They might be a bit uncooperative sometimes if that's what they're being told to do, but no one's going to be horrible to you. And, you know, if OSCEs and clinical skills don't come easily to you first time, that's absolutely fine. They don't always come easily to everyone. So just give it a chance. I know some people feel, oh, I'm not very good at clinical skills, you know, that means I'm going to be a bad doctor. And that's not the case, but sometimes it just takes a bit of practice. So in my second year and my first year, our end of year exams, we have 4 end of year exams, 1 on medicine, 2 medicine 1 and medicine 2 in first year, then biomedical skills in anatomy, and then medicine 3 and 4 in second year, integrated medicine and biomedical skills and that sort of thing. And the biomedical skills exam includes calculations, so we do blood test calculations, dosage calculations, and we might be asked to look at liver function tests and lipid levels and that sort of thing, and interpret things from that. Make sure that you're writing down how you do your equations and you're doing it systematically, and you go over and check your results a couple of times. Try and take your time when you're doing these calculations, because it's really easy to go wrong with them sometimes, and it's easy to get confused with the calculations as well. So make sure you are just trying to stay on track, and if you do get a bit flustered or confused with the question, move on to the next one and come back to it if you have time. So the key concepts that I covered in second year outside of just anatomy were the kidney, fertility, endocrine, so everything from, you know, Cushing's to diabetes, and brain disorders, so things like MS, ALS, that sort of thing. You might cover different things, you might do it in a different order. Make sure you start your revision early and do your revision well. And even now, I think I still kind of struggle a bit to find the right way to revise. I think in your preclinical years, it can be a bit more difficult because some of the resources aren't as tailor-made to you, or they're a bit too advanced for you. So flashcards are a great way to do it, but try and focus on the key things for flashcards, because otherwise you'll end up with about 1,000 and you won't get through all of them and you won't remember it properly. Make sure to stay on top of your lectures. There's nothing worse than being behind in loads of lectures and then you've got to catch it all up, and that can just make you feel really overwhelmed. Ask questions to your lecturers, to your peers if you don't understand things. Send them an email if you feel a bit intimidated by putting your hand up in a lecture. But if you're confused, ask people. You know, no one's going to bite your hand off if you're asking a question. Some challenges, so balancing free time and work in second year, and even now it's still a bit difficult to do that. The way you can do this is having a timetable. I love my Google Calendar where I can block out all my time, so I know when I'm going to be working, I know when I'm going to be not going to be, because having fun is just as important as doing work in medical school, because otherwise you're going to get burnt out, and that's the worst thing. You don't want that to happen. So make sure you're taking time for yourself and to spend time with your friends. Also in second year, it's a bit different, I think, for every uni, but in Nottingham, second year is our last kind of full summer holiday where we get about 3 months. So make sure to take advantage of that if you do have less summer holiday after you start placement. I was doing revision and note-taking techniques that didn't work for me. So, I was making summary notes and nothing was really going in. I was doing it, wasting my time doing it, but it wasn't actually helping me. So second year I did flashcards, whereas in first year is difficult for me as well because our exams were open book in first year. So in second year, that was my first year since my A-level mock exams that I'd actually done an in-person exam where I had to fully memorise everything. And for that, I did flashcards and found some online question banks as well. Some topics I really didn't like. I really didn't like renal, and that was really difficult for me to do, especially when you don't really understand something, you're not that enthusiastic about it. It can be hard to get motivated, but you just kind of have to break it down into smaller chunks and do it that way, I think. So things I enjoyed. For me, second year, we actually started having in-person lectures. So I had more of a chance to meet people, which I didn't really have in first year. Obviously, that'll change for most of you in first year now because things aren't kind of disrupted by the pandemic anymore. But I actually got to meet people and other medics, which was nice. I like going to the library. I think going to the library is so much better than just staying in your bedroom and doing your work, because I remember in first year, I literally lived in my bedroom in halls, and it's not like fun, because then it just feels like you're just getting from your desk and going into bed and getting up and getting to your desk again. So I definitely recommend finding a nice study space that you like, whether it's the library or, you know, a cafe or something that you like to work. Put myself out there a bit more and got involved in societies, and that's where I met like some of my closer friends as well, through societies, and met new people. So I definitely would recommend getting involved in societies, not just sports societies and things like that, but also academic societies. I'm on the committee for quite a few societies, and I think it's a great way to make friends. And also taking time for myself and enjoying myself and making memories, because you don't want to, at the end of the day, we are going to uni to get a medical degree and become doctors, but you also don't want to look back at your time at uni and think, you know, I really didn't enjoy that, or I wasted my time. So make sure you're doing things that you enjoy and you're going out and making memories. Exam advice: start your revision early. Don't be afraid to try new techniques. If you spent 6 months doing one technique and you know it's not working for you, even though it can seem very painful to let all of that hard work go, try something new and see if that works instead. What worked for you at A-level might not work now. There's more content. It's hard to do the same things you were doing when you only had, you know, one textbook worth of stuff to revise. Now you've got kind of one A-level textbook. It can sometimes just be 1 week of lecture, so it's not really doable to revise the same way anymore. You might still be able to do that, but a lot of people can't. Make sure you're paying attention in lectures and actually listening to what the lecturer is saying. There's no point you going to a lecture if you're not going to listen to them. You might as well just not go and write your notes out by yourself. Make sure you're doing active recall rather than passive revision. Take time for yourself. Remember, you're not defined by a grade. A lot of people, when they come to med school, you might not get the same grades that you used to, or the same percentages that you used to at A-level. You know, at A-level you used to be in kind of at the top of your cohort. That might not be the same for medicine, and that's fine. You might fail an exam, and that's also fine. At Nottingham, you have another chance to resit, and then if you fail your resit, you have the chance to resit part of the year as well. So you always have a second chance if something goes wrong. And also keep a routine. So make sure you're keeping the same routine as you were before exams, during exam season, because that can kind of help reduce your stress. And I think having a routine and getting into that really helps. And then finally, just some top tips. Make the most of your time. You'll be at uni longer than most of your friends. If you're living with medics and living with non-medics in first and second year, the likelihood is, you know, they're gonna graduate and then you'll move in with medics. Year 2 is usually your last preclinical year. It is for me, so make the most of it. You might have more free time than usual. Go out, enjoy societies, make time with your friends, go on holiday, do all them sorts of fun things. You don't have to be sporty to get involved in societies. You can do non-sporty societies or kind of less competitive societies as well. So really make the most of your time at medical school. I know it does seem really hard with the amount of content, but find a good balance between work and fun, and hopefully you'll have a really fulfilling time at med school. So if you have any questions, that's my email. Yeah, I'm happy to answer anything. Thank you.
Thank you very much, Asia. That was actually really, really great. And it's that whole sort of idea of, you know, work-life balance. You know, I think even like in the job as well, like you just hear it's such a big buzzword, trying to find that work-life balance, and sometimes you're still trying to find it for the rest of your life, and that's okay. But just making sure you focus on those times where you're just enjoying like stuff, whether it's medic or non-medic related, is good to have a bit of everything and doing a bit of everything. So getting stuck in societies, you know, going out, you know, enjoying yourself basically. And I think second year is a good sort of place to do that, because you're kind of setting yourself a foundation from first year, adjusting to university life, and then, you know, second year you kind of know what you're doing. It will change as we'll get onto with Nitika in third year when you're hitting clinical stuff, but you know, it's a good time to obviously, go out there and do other things. So no, that was great. So we'll go on to third year. I know we're wary of time, so Nitika, if you would so kindly.
Yeah. Happy enough, yeah. I'm Nitika. I'm a fourth year at QUB as well with Tulika. I'm going to walk you through third year as a medic. So yeah, this is your first clinical year. There's a lot of different changes in terms of what you've been doing with medicine in the first 2 years. You get to do a lot more practical learning. It's more hospital-based, and I think the biggest difficulty people find is that it's a lot more self-directed learning, and you decide when and what you are going to be focusing on in terms of the education that you get. But it is quite possibly, I think, my favorite year, and it's very exciting. You get to sort of get out of the textbooks and do a lot of the stuff that you sort of set out to do. And just sort of preparing for this year, that big shift between being and going to lectures and then being on the ward and learning all this stuff practically. So sort out all the practical stuff early on. If you have peripheral placements and you need to be traveling or you need accommodation, get all that sorted so you're not worrying about it last minute. And if your university is good at giving you your timetables in advance, take that to the advantage, plan things out. And if you know what you're going to be doing when in terms of specialties, you can set up a little bit of a revision timetable, but do take the time over the summer to actually enjoy your time off and your summer, because those really start getting shorter and shorter as you go on through medical school. So don't be revising over the summer, but definitely sort of know what you need to know as the year starts. And I know we've mentioned quite a few of these resources, but they're really good. Zero to Finals is great. They're really good at condensing information into very small bite-sized little chunks, and they have some of the very examinable material on there as well. And then, of course, a lot of people have mentioned about, and Philip was mentioning about, like, active learning. So use that to your advantage. There are a lot of question banks out there with PassMed, QuesMed, and I'm sure there's a bunch more. So use them whenever you can. And I personally really liked Medicine in a Minute for my third year. They have a lot of condensed and well organized material in terms of how they run through specialties and the conditions for each. So if you like stuff like that, you definitely check that book out. It's really good. And then tips for being on the ward. So being on the ward is very different. It can be very intimidating when you're first on the ward. So first tip is don't be late, especially on your first day. Once you've got the lay of the land, feel free to show up like an hour or so after ward round start. But on your first day, just make sure you set that very nice impression. And always, always, always introduce yourself. It's sort of kind of the mainstay of really anything you do in medicine. You always introduce yourself first. So make sure you introduce yourself to your patients, anybody else on the team really. So doctors, F1s, definitely introduce yourself to them, since they will be the kindest people on there, and they know the ward like nobody else. So you really want to be nice to them. But yeah, just introduce yourself, and if you have any things that you want to do, just be very open about it. Ask about it. Ask any questions that may come up. Don't be afraid to speak up either. And consequently, like, if you're asked questions, try and give an answer. You're not expected to know everything. You don't have to know everything. And I know as a third year, it is a little bit intimidating to go, oh, I don't know. But really, as a fourth year, I have absolutely no shame in going, yes, I don't know the first line management of hypertension, when really I should. But yeah, so show up to the opportunities if they are brought up for you. And if you really want to do something, ask. I think the best thing you can do is, if you're interested in something, and if you are motivated enough, most people will be kind enough to give you that opportunity. And if you are going to opportunities outside of boards, so like if you're going to clinics or if you're going to sessions or teaching sessions, try and do some reading beforehand so you're prepared for it. It doesn't have to be anything extensive, just so that you sort of, whenever you're in those scenarios, you know what's happening. And you're able to have an understanding and can go away from it and know what you need to know. And then you can consolidate all of that information and learn from there. And then on the wards, be kind to patients. They are definitely there for you to learn, and they're great learning resources, but they're also people at the end of the day, and they are in hospital and are fragile and vulnerable. So be very kind. And on that note, do actually interact with them, talk to them. Your best history taking practice will come from having conversations with patients and examine them as well. And I know that this is very different to what an OSCE situation would be like, but it is also very great to get the practice of the motion of actually going through examinations. So definitely practice whenever you get the chance. And like Aisha was saying, for OSCEs, just practice in general with friends and everything, and you'll be okay. And then sort of preparing for the next few years. I know I've put there, think about your career, but what I really mean is, regardless of whether or not you like a specialty in be it your third, fourth, or fifth year, try and give it your most, because you may not go down that route later on in the future, but there's definitely something you can learn from it. So show up to the teaching sessions, show up to the ward, try and interact with the people there, and make connections, network. This is sort of the best time to start networking, both your peers and people who are in the healthcare team itself. And like mentioned before, like join societies if you're interested in things, be it in medicine or outside. Give it your time of day. Attend events, get to know people. This is sort of also the best time to start getting into audits or intercalation if you're thinking about it. I know we have a talk coming up on that. But also know that there's no pressure absolutely to do any of these things. If you just want medicine to be a degree, it can very well just be a degree. And you can go out and do whatever else you want to do and come back and just sort of study for exams and everything. So yeah, it's really personal. Make your experience your own. And yeah, general tips and tricks. Don't be hard on yourself. Medicine's really hard in terms of the content, but also once you're on the wards, you see a lot of things and you deal with a lot of things that are very challenging. And be kind to yourself, be kind to the people around you, and just know that people really shouldn't be mean to you, but sometimes they're just having a hard day, and don't take it too personally. One bad day doesn't define your entire year in medicine. And time management is really important. So one of the biggest pieces of advice I'll give you is that if you're on the ward and you feel that you aren't exactly learning anything, go home. You're going to be more productive being home and maybe revising or unwinding or getting a snack than you will be standing around trying to figure out what to do on a ward. And be on top of your work. So try not to let it all pile up, because that can be really hard to get out of. And also give yourself time to figure out how you work. So like Asia was saying, like if you work best taking notes over and over and over, do that. If you work best doing a bunch of questions, do that. And if you don't know, try a bunch of things and figure out exactly how you learn, and just go from there. And like I said, be confident and comfortable to head home if you aren't getting any teaching, because you may as well not waste your time. And my last thing is be kind to yourself. Mental health is so important. And I think as your years go by and as you go into a medical career, it's very easy to burn out. So take breaks, leave early or come in late, and cut yourself some slack. You don't need to know everything. And the very exciting thing is that all the things you don't know, you have the opportunity to get to know. So take it more as a learning opportunity than anything on your account. And be nice to each other. You're all medical students and you're all in the same boat. So help each other out, study with each other, give each other tips and tricks. Like if you found some resources that you think help a lot, use those and share those. And if you think that, you're getting too run down or you've taken on too much or you're getting overwhelmed, take a step back, de-stress, and then you can come back sort of fresh, because medicine's sort of a long haul thing and you want to sort of create these healthy habits to get you through it all. But thank you very much for listening. That's everything on the third year. It's very similar to the next few years that we'll be talking about. So if you have any questions, I think my email is at the very beginning of this presentation. Shoot me an email. I'm more than happy to answer. And I think intercalation's next.
Yeah, no, that'll be intercalation. I think Nav is around as well. Thank you very much, Nitika. That was very, very insightful. And one big thing to take from that is definitely the mental health aspect about it. I think, and I'm seeing this firsthand as well as an F1, you can see burnout. It's obvious those people that put 100% shift in, which is good to do obviously in medical school, but you can see that they've only just got 1 year into the job and they're already feeling so overwhelmed, and some of them want to go into medical consultants. They haven't even hit IMT yet, which is supposed to be like the big chunk and like the really, really hard year. So definitely pace yourself, think about your mental health, have a good support system. You know, clinical years is a different step from preclinical as well, obviously getting used to the wards. If you're not feeling that what you're doing is productive, it's okay to go home and just chill with your books a little bit as well. It's, you know, trying to find and strike that balance is a big thing that you'll learn in third year, I think. So no, but definitely looking after yourself as well is a very, very big thing. So thank you very much for bringing that up. So Nav is going to talk a bit about intercalation as well. I'm pretty sure he is here.
Hello, can everyone hear me okay?
Yes, yes.
Thank you, Bilal. Thanks for having me. Yeah, so hi everyone, I'm Nav. I'm a final year medical student at the University of Manchester, and thank you very much for your time. And I have to say the speakers so far have been brilliant. You know, really good advice given by everyone. So yeah, I'll be talking to you about intercalation in a bit more detail. So for those of you who didn't know what it is basically an additional year of study on top of the course that you're already doing. So whether your course is 5 or 6 years, this is an extra year in which you get to do another degree, essentially. So I chose to intercalate between my 4th and 5th year. A lot of people tend to do it between their 3rd and 4th, however, both are suitable. And in some universities, you can even do it after the 2nd year as well. So yeah, the point of it is to explore a new area in a bit more depth, gain new knowledge and develop new skills, basically. In terms of the possibilities of degree, you can pretty much do anything that's offered that's under the sun. So like, I'll go into some examples later. You can do things like a bachelor's, master's, both are available. One might be a bit longer and a bit more work than the other one. But that's intercalation in a nutshell. So the reasons to intercalate, as I said, you get to gain new skills, experience a different kind of study that is much different from the kind of work that you've been told about by our lovely speakers earlier. You can develop a really good foundation for academic medicine if that's what you find interesting. Your CV looks a lot better. You can take advantage of scholarships, bursaries, and prizes. And the courses that you tend to do are pretty much developed specifically for people doing it in 1 year. So it's essentially having like a BSc, which would normally take 3 years to do, adapted for a medic to complete within the space of less than a year. So that are the main reasons to intercalate. There are reasons why people are less keen on this now. So to be completely transparent, it's not worth any points as it used to be when scoring on the UKFPO system and also for the specialty training as well. That is subject to change in the future, obviously, but because it's not worth the points anymore, people are less keen to do it. However, I would still strongly recommend, if you do find something interesting and you have an idea of what career you want to do, then you most certainly go for it. Examples of courses. So this is a glimpse of what the University of Manchester offer. One of the most popular courses is a BSc in global health and anatomical sciences as well. Like if you, for example, if you want to go down surgery, that's something you find interesting, that's a really good one to go for. And you can do pretty much anything and tailor it to what you want. So I intercalated at Barts in London, and I completed a degree in sports and exercise medicine. I chose my long project to be on football medicine. So that's an example of you tailoring what you want out of the course. How to prepare for the year? Firstly, decide whether it's for you or not. There's no point forcing something when you already have quite a long course. And once you've decided whether it's for you or not, find one that's aligned with your interests and your intended career. So in my case, I find sports medicine very interesting. It's kind of what I want to do going forwards. Therefore, I took this year to do this course. Think about whether you can stay at the same uni or is your course available elsewhere. So in my case, Manchester did not offer the courses yet. So I looked at Leeds, Loughborough and Barts, which managed to do it. Check the course material. All 3 courses that I mentioned for my degree did differ. So see which one fits you better. And another way in preparation is the introductory modules will definitely prepare you for the research related tasks. For example, we had talks on how to conduct research, literature reviews, critically appraising papers, and how to use data analysis tools. So these will really prepare you for the year. and the staff who I had were really nice and, you know, were always there to help. So it's something that's completely different from what we've mentioned before. For example, going onto the wards and taking histories and examinations. This is a bit different, but I would say it's definitely worth it. How different it is, as we mentioned, so it does depend on the course. However, some courses will have like a placement element as well. There's definitely new content that you learn that will go a long way for a specialist career. It's definitely less intense. So coming off my 4th year, in which I had 32 weeks of placement, which me and Bilal, you know, had to go through, this was nice to have a year where it was a lot less intense. The only thing is there's a bit more essays. I'm strong, and long writing is not my strongest subpoint. I'd say things to look out for while you're intercalating. You can use your free time to do other activities once you've completed the coursework at hand. So when I was at Barts, I managed to get involved with societies, you know, playing some sports teams, and also do part-time jobs alongside, which I might not have been able to do had I gone straight to 5th year. Definitely pick the right research project for you. You can, you know, explore your interests and see what appeals to you more. And you know, there's a chance that you could get a publication out of it as well, should you play your cards right. Sorry, I think that's the end of my bit, I believe. So thank you very much for your time. I'll leave my email in the chat box below, so you can feel free to ping any emails or anything regarding medical school as well, as I'm a final year. So yeah, feel free. Thank you very much, everyone.
Yeah, cheers, Nav. Yeah, and I think intercalating is definitely a big thing to consider. I personally didn't do it, but looking back at it, you know, with different career aspirations, I would definitely consider it. And there's such a wide range of things you can do. You can either do it in your own university, or you can go out and explore. So I think it's definitely an option to, you know, take a step away from medicine, but keeping a bit parallel to it and do something that you really, really enjoy, or just do something a bit different, which would be nice. Moving swiftly on, thank you very much, Nav.
No worries, thank you.
Would like to give us an insight into 4th year. I am aware it's 5 minutes left in the meeting, so I'll let you begin your talk, and then as and when it tells us to cut, we'll re-enter the chat.
Sure. Should I share my slides, or?
You can take control of these ones.
Okay.
Will be your slides on here.
Okay, so can you see the slide where it says what's it like to be a 4th year student? Okay, so hello everyone, my name is Janahan. I'm a 5th year medical student at UCL, and I'm going to be talking about my experiences of 4th year. So let me just share my slides. Okay, so just a little disclaimer, I'll be talking about it from a UCL perspective. So the first 2 years are pre-clin. My 3rd year was where I did an IBSc in neuroscience, and 4th year onwards is clinical. And I'm aware that some universities have similar structures to this. At the top of my head, Cambridge follows a similar structure. I know others will slightly differ. So some universities may choose to do their intercalated as a different year. But it's almost guaranteed that all of you will have finished pre-clinical medicine at this stage and will be doing some form of clinical medicine right now. So just to sum up preclinical medicine in a nutshell, it probably involves sitting in lectures, listening to the lecturer, and being incredibly stressed for your exams at the end of the year. Whereas clinical medicine would probably involve being on the wards, examining patients, keeping up with deadlines, and still being stressed for your exams. So not much changes there. But in essence, what to expect from 4th year? So the first thing that you probably hear people tell you is that it is a very, very long year with a lot of work. So they'll often describe it as the marathon and not a sprint. So it's very important to pace yourself. What makes clinical years so different to pre-clin years is that there's a wide range in the work that you do. So this will just involve theory, but also being on the wards, carrying different procedures, the list goes on. And another thing you have to look forward to is deadlines and sign-offs for every term. So they will often give you a checklist of things and tasks that you have to do, and it's important that you get this done before the end of the module. Another thing to note is a lot of admin. So what I mean by this is there's a lot of deadlines that you will need to complete. So whether this be like sending in certain types of emails, completing different tasks for admin, it's important that on top of the work, that not only are you on top of your work, but you also get on top of all of the other stuff as well. And there is also a recurring theme of balancing your time and figuring out where your priorities lie. So here are a few tips and tricks for fourth year and things that I found were very useful. So the first key thing is to work smart. It is quite a cliche, but it's true. So what may work for someone else may not work for you. So let's say one of your friends prefers to do all-nighters and is able to work hours and hours and hours on end. I know someone who can do this, but I know that's not for me. So I much prefer to pace my work and spread it out over a couple of days or a few hours. Also, what may work for one area of medicine may not work for another area of medicine. So what you find is that in order to revise anatomy, you may rely on pictures and pictures, whereas for things like revising, let's say neuroscience or RESP, you probably prefer taking notes or creating flashcards for this. Another thing to note is to look for ways for it to fit in your timetable or daily routine, so you maximize the amount that you get when it comes to working. So let's take my case, for example. So I usually commute to uni, and it will probably take me about an hour to get there. So an hour there, an hour back, that's 2 hours in total. It takes up quite a bit of the day. So what I did was I made Anki cards, and I would pretty much do them on the train. So what becomes 2 hours of travel time ends up becoming 2 hours worth of revision, which then is very good. Another thing to note is to not have your notes in the book for the entire year revising just theory, as there's a lot of things that you can learn on the ward. So the patients are there. It's far easier to remember certain conditions and certain traits according to these different conditions from the patients and by interacting with these patients as well. So do take full advantage of that. Another thing to note is to pre-read before and consolidate afterwards. That was definitely something I would recommend doing, because as I said, there's a lot to learn, but if you can get that little bit of a head start and then consolidate after, then that knowledge is just going to stick in your head. Another really important thing is to not leave anything last minute. So when it comes to revision, such as OSCEs and SPAs, you definitely want to do them now. So it's important to know that you don't need to have all of the knowledge or understand all of it or remember it at this moment. You are learning, of course, but that's even more reason why you need to get a head start and try and do it as soon as you can. Another thing to note is that if you have a deadline, get started on it as soon as possible. So you may be given things like casing the modules or essays. Just make life easier for you and try and get it started now and work on it bit by bit, because cramming does not work for clinical years. That's not something that you definitely want. That's not something you want to do for this year. Another thing to note is to clarify what are the mandatory stuff for the module all year, so get any confusion out of the way. So usually at the start of the module, they'll tell you to have a certain checklist, but there may be times where they may not make it clear enough, or there's some things that you don't understand. You're better off sorting it out now than finding out last minute that there's a requirement that you're missing out on and you need to get it done. So do make it clear, or do make sure that you understand everything at the start. Another thing is sign-offs. So in my case, sign-offs include things like talking to the patients, case-based discussions, or carrying out mini KEXs. So these are mini examinations. So things like the cardio exam or RESP exam. Do get them done at the start of the module. So if you can, go into the wards, do as much as you can, and make life a lot easier for you and save yourself some future stress. Another thing to note is the OSCEs. So again, get started on that as soon as possible. So there's many different ways in which you can prepare for OSCEs. You can pretty much do questions, but one thing I found that was very useful is to work in a group. So sometimes the best resources are the people around you. But a little key thing that I've learned is that if you're going to work as a group, try and keep it small, because you can get a lot of people together, but the problem is someone may not be available at a particular time. So you probably spend more time rescheduling than actually preparing for your OSCEs. So do keep it small. And in fact, you may not even need to have a group. Just work with whoever is available. Another thing to note is that some things that are relevant to the OSCEs can be done on the wards. So things like examinations and procedures, you may be tested on this. So that's even more reason why you should be on the ward as well to practice those things as well. And again, ask doctors for help. So they may be busy, but some doctors are more than happy to help you regarding how to refine your technique or talk about how to present. Because one of the skills that you need to know as a future doctor is to how to present cases both succinctly and effectively. It's a very important skill, and many doctors are more than happy just to listen to you and give a bit of advice on how to improve the numbers. So here are the list of resources that I found especially useful. Anki, I think Anki is absolutely brilliant. I'm pretty much its #1 fanboy. So I said you could pretty much just test yourself constantly without access to the internet. PassMed is absolutely brilliant. So they have an online textbook that you can use, and they have a massive question bank for you to test yourselves on the different rotations that you'll be on. QuestMed as well, similar thing compared to PassMed. Zero to Finals got some brilliance as well. OSCE and Geeky Medics. So OSCE they have a massive blue book on all of the different stations that could come up in your OSCE. So definitely get that. That's a worthy investment. And also there's Geeky Medics as well. So that's a very good website that will definitely help you for your OSCE. And finally, there's the Oxford Clinical Handbook. So that's a small book. Many people say it's like the Bible for medical students, but it has pretty much everything and anything that you need to know for the conditions that you'll be tested on in your final exam. So despite probably drilling in how long and stressful the process is, I consider fourth year to be probably the best year of medicine that I've had. And here's some of the reasons why. So first off, you actually feel like a doctor. It is such a refreshing change from first year, second year, and third year. And I know COVID certainly hasn't helped. No. But to actually be on the ward, talk to patients, carry out examinations, doing different procedures like taking bloods, blood cultures, or doing an ECG, you really actually start feeling like a doctor. And it's a good reminder as to why you've chosen this degree in the first place. Another thing is that you get to experience new things that you probably wouldn't in pre-clin. So some of the things I absolutely loved in fourth year is night shifts. So I had the opportunity to do a couple night shifts, and they were absolutely brilliant. Another thing is that I loved being in theatres, and I got the opportunity to join the surgeons and also join the anaesthetist team and even help out with a couple procedures as well. Next, you also make friends with people you probably never met before in medical school. So in my phone group, I was allocated with a group of people that I didn't even know in first year, second year, or third year, but we got on and eventually we became good friends. So you probably end up meeting loads of people in med school that you probably haven't met before, and it's never too late to make new friends. And another thing is that you get insight into the different specialties, and it informs you of what you want to do and what you don't want to do. So I'm not a big fan of certain specialties such as renal. Renal has always been a bit difficult for me, but it's also reaffirmed some of the things that I look forward to. So I absolutely love being in theatres. So I'm definitely interested in surgery. So any opportunity to be in the theatre and scrub in, whether it's to help the surgeons or the anaesthetists, I absolutely welcome with open arms. But also you may be pleasantly surprised by other specialties as well. So in my personal experience, one of the specialties, which I would say is the highlight of the year, would be in acute. So being in the emergency department, helping the doctors out, and that's why I've done my night shifts. And I would say that was probably where I got the most experience in doing these different procedures, helping out in emergencies. It is something that I've enjoyed a lot, and it's certainly something I actually look forward to in the future. So in summary, this is definitely a very long year, a lot of work, a lot of revising, a lot of preparation, but also make sure you enjoy it as well, because it's definitely a fun year. And also make sure you give time for yourself and be kind to yourself. As I said, we're all medical students, we're all going through this together, and it's going to be a long process, but we might as well make it a good one. So I think that should be everything.
Oh, great. Thank you very much, man. It's really insightful to look into a bit about fourth year, and pretty much what for most people will be the penultimate year before they get cracking on with their finals. Is definitely puts you in that sort of position where you're kind of slowly starting to feel like a doctor as well. and you get to experience a lot of broader specialties and, you know, different things as well, which is, you know, the main thing. You want to have a good scope of things before you start going into F1, F2, because once that happens, then obviously you've got a big focus on specific specialties. You pick 6 over 2 years and you'll kind of focus on that for 4 years. So you kind of feel like you miss out on everything. I'm on Gen Surg right now, and it feels like everything else that I learned in med school has kind of just gone out the window. But I do reminisce on the times where I had, you know, a bit of time to spend on different specialties. Not renal, but majority of the other specialties, which is, I think, is a common takeaway message, that no one likes renal. And I can safely say that that continues on into F1 and F2. So, but yeah, no, really good stuff. And I do think as well, one key thing from that OSCE is definitely the less of you is better, because like you said, too many of you always feel like you want to make sure that everyone's there, problems with the rescheduling, that sort of thing. And a good thing about OSCEs as well is that you get to just pick up small things from other people that you wouldn't normally like be able to do. Like some people I knew would practice at OSCEs, you know, just on a mirror, which is fine, they can do that, but they just don't pick up those small gems that you can just get from other people. They won't even pick it up themselves, but when you hear them talking about it, saying, you know, icing a patient, and they do it in such a natural way, you kind of just like, whoa, that's insane, I'll pick that up. You tell them about it, they're like, oh right, they focus more on that as well. And it does, yeah, you're right, it does bring like the sort of people that you've never met in medical school before into like a new batch as well. They keep chopping and changing, which is good. It's really insightful how they do it in UCL as well, but it's quite uniform, I think, for just medical schools nationally. Anywho's, I know I digress. Again, mindful for time, I will just go swiftly through final year. There isn't really that much to cover or that many differences. Obviously, placement, you know, it's pretty much the same as it goes from 3rd, 4th, and 5th year. But there are quite a few other additional aspects. Obviously, you're going into your final year, you're going to start, you know, finals preparation, where depending on where you are, you're going to cover all the bases of every single thing you've picked up. Some places focusing more on the clinical years, and some places, if you're learning spirally, you get to still be assessed on stuff you learned in 1st and 2nd year. So obviously a good thing that I think a lot of people mentioned today as well is liaising with students in the year above you as well, getting their notes, sharing their resources, and kind of understanding what the assessments are like before you tackle them, because obviously they will be the experts as well. So it's definitely good to make friends with the years above, which I found was like one of the big useful things too. But this generally, this circle and this flow diagram kind of gives you a brief description of some of the additional aspects that you get alongside your finals and placement. So I'll cover a bit of them briefly, and hopefully should give like a decent idea as to what kind of stuff you need to prepare for in final year. So one of the main things that you'll come across is something called FPAS. So this is basically the foundation program application system, and how this works from when I did it, it has changed recently. So before, when Nav mentioned that stuff like intercalation and then, you know, publications and stuff like that would get you points, those are completely void. So now they've changed it as a 50-50 system. So 50 will be on your educational performance measure, which is basically measured as a decile depending on how you rank in your cohort. So your top decile, so if you're in the first decile, you get 50 points. Bottom decile, you get 41 points or 40 maths, whatever. So that basically, I kind of looked at that as like, you know what, you could be in the bottom decile, but you've got a guaranteed amount of points. The other 50 comes from your SJT. So I'll touch a bit on that a bit later, but that collates it to a total of 100 points. Then when you're applying, you're going to hear the buzzword called oral when you apply for in final year for these different deaneries. Each deanery has their own minimum cutoff, and then following admission into those specific deaneries, then you get to rank those jobs. I will do a session more on FPAS. I'm pretty sure for those of you that are on that sort of FPAS journey already, you'll have done your you know, initial oral applications, booked your SJT and stuff like that. So I've left a few links on here just to for anyone that is interested about stuff like ranking foundation jobs, how the foundation program works as well, and stuff like that. There are other ways you can apply to the foundation program, including AFP, specialized foundation programs and stuff like that. I think that'll be something that we'll cover more in a specific talk on FPAS. But this is the whole like big thing that you're getting on the side. I did mention SJT. So SJT obviously makes up 50% of your overall foundation score. For those of you that can recall back to UKCAT, or UCAT as it's called now, it's basically like an extended version of this. You get different sets of questions, ranking appropriateness of like 5 statements is like one section. Sometimes you get video questions as well. And typically it's kind of used to assess how a foundation 1 doctor would approach a situation. It can be a range of things. It could be like your class, like Jehovah's Witnesses and blood transfusions. It could be religion. It could be euthanasia and stuff like that. And bearing in mind, in those situations, you have to make you answer as an F1 doctor, not as anything else, not as a med student, consultant, whatever, as an F1 doctor. So the main advice I'd give for this, 2 main advice I'd give for this, is to prep for your SJT, go into going into placement and basically gauging these weird ethical situations and understanding how F1s would react in that situation. I can see, like, retrospectively now what it means for an F1 to act in a situation now that I've started working in the job. So it's definitely good to get some advice from them about how you would act as well. And it's kind of like a trick sort of thing where how you act and how they want you to act is a very fine line between them. So the way to get around that is using the SJT papers online. So I've also left a link on there as well. The practice papers are your golden ticket, and they are the main source of help that you get from the foundation program. So they're definitely your go-to, because they're what the foundation program goes and provides. The other thing that you'll come across is apprenticeships and projects alongside your placements when you're done with your finals, or alongside your finals as well. So some universities, if not a lot of them, following their finals have a short apprenticeship period. This can be anything from like a few weeks to a few months, and that kind of basically preps you for your F1 practice. Bear in mind that different deaneries and different hospitals will have a different approach to how F1s work in their system, but this gives you a general broad overview of what like a day-to-day F1 would do, and kind of puts you in their shoes. So you'll be doing all the stuff like on your ward rounds, you'll be prepping the notes, or doing bloods, doing cannulas, ordering investigation and stuff like that. And then in other situations, either alongside this or separately, you get to do a project as well. In Manchester, they allow us to do a project on the side. It was mentioned before, it can be good for stuff like portfolio building and all of that. So doing a research or audit as well is a good thing to do in your after your finals as well. Once you know that, touch wood, that you've passed, you'll be able to put some focus into that as well. Another assessment that you get in final year is your PSA. It's basically an assessment that's done to, you know, prove that you're a competent prescriber. Usually this is an online paper that you do. Long story short, with this, having done the paper, it's a very command F sort of game where you're given your BNF online, you're given microguide online, and what you have to do is, like, each scenario gives you a situation where you just have to go and quickly find the drugs. Like, it's so difficult to remember all the drugs and their side effects. Like, I wouldn't be able to remember it now as a doctor. Like, you pick it up slowly, but it's very hard to remember all those really niche side effects. So that's the main aim of the game for PSA. Again, we will have a session on that as well, as like a prepping for PSA 1. And the main way to get about that is going through the practice papers that they offer on the PSA website. So I've left a link in there too. With the PSA as well, you do get, I think, 2 opportunities to take it in your final year, I believe, if not 1. And then even if you don't pass it, you are able to take it as an F1 later. So obviously, if you can't prescribe as an F1, then they may look at you a bit, nurses may look at you a bit differently, and they may frown upon you when you told them that you're not able to prescribe as an F1. So it's good to pass before you finish medical school. Not that I've covered it in this slideshow, but one thing I did want to touch on for the 2025 graduating year, you do have the UK medical licensing exam as well that you have to take. So if any of you guys are in that too, in that cohort anyway, for those guys, you will have to do an additional examination that's been you know, allowed to happen by the GMC, which is basically like a competency thing which you're required to pass before you begin to practice. There's not really that much information on it, to be honest, and they're looking at piloting it first before that year. But the main thing is that it should be done alongside your finals, and it shouldn't be any different from your finals exam. So all the knowledge and information that you need for your finals that are given by university, you would need to use for that medical licensing exam as well. I think it's like a multiple choice question. I think it's like between 150 and 200 questions, something like that. And once we find out a bit more information on that, then we'll be able to provide that in one of our other resources. Okay, so that brings us to the conclusion of our talk. Thank you very much, guys, for sticking through and getting through with us on this first of our hopefully many talks by the UKMSA. We really appreciate you sticking around. Thank you very much for your time. We are opening the floor to some questions. We will have the slides available for everyone to use, and obviously we have our we are free to answer any questions either via now or through our email later on as well. But we do thank you. Obviously, we'll keep you up to date and posted in terms of our socials when we'll be having new events, starting our webinars and stuff like that. So do tune in and keep up to date with that. One other thing that I would like to mention as well is that we do have some spaces available in terms of recruitment, and we do have a number of places available on the committee on other positions. So we will send a link on that. I don't know if I have the link on here, or maybe Asia has it, but we'll send the link on the chat as well for people to apply should they want to and join our budding society. But that's everything from me. So thank you very much for your time. We do have a lovely QR code at the end. If you could please fill out some feedback, that would be great. Obviously, feedback is a big thing for us to make sure that we are able to improve and make the society better for you guys, the medical students as well, because that's the main aim of the game. And hopefully we'll be able to deliver better and more improved sessions. So thank you very much for your time.